Hi, I'm Pratyusha. I'm a HR professional working in Bangalore, and this is my mother. My mother is 71 years old, and we are in Bangalore. My mother suffered a stroke 2.5 months back, exactly 2.5 months back. It was, I think, more than anything, it was a shock for the entire family. Because of the stroke, she had a weakness that affected her entire left side of the body. So she was not able to move her left hand, her left leg. So it was completely, motionless. And because of the stroke and the medicines and the medications, she was also not in a very good mental state of mind. So that is the situation in which we actually were looking at a place where we could find some relief and get my mother back into normalcy. So while we were in the hospital, the doctors suggested us to take her to a place which would give her an aggressive physiotherapy, because that is what she needed. And when we actually started searching for a place like that, there were many places that we found on the internet which were very similar and offered very similar services. But we were specific that we wanted a place that would give her a lot of stroke-centric physiotherapy services. So that is how we actually finalized on Sukino. It was the one that we came to the Sukino in HSR layout, and from the day we moved in here, just about 4 days, immediately 4 days after she suffered the stroke, and we've been here for about 2.5 months. And from from the earlier state of mind where she was not able to move, and to today, when 2.5 months later, when she's able to kind of walk with a very minimal support, she's able to walk. She's able to move her hand, she's able to read the newspaper, do things like that with very minimal support. That itself gives us a lot of relief as a family, as a daughter, gives a lot of relief. So since the day we came to Sukino, in fact I remember the exact moment we stepped into Sukino, the first person I spoke to before coming was Rajni. She was the facility manager, and she was so calming. She was so supportive. She's very calm, throughout, and she gave me a lot of confidence, to bring mom. They'll take care of anything. Just come. That is the kind of at that point in time, that's what I really needed. And then we came here. The moment we stepped out of the ambulance, and the kind of the caretakers, they all come in. They are all very experienced in what they do. They are thorough with their hands. The way they kind of move a patient right from the gates to the room, it's done very professionally. That they know their job really well. So we were introduced to the caretaker, to the dietitian, to a personal caretaker. So she was really good, very, very supportive, Teresa. So especially during the initial months, or even the nights when a patient needs a lot of care, they do it very unflinchingly, without any complaints, with a lot of patience. Every single person, they not only deal with the patient and their requirements, but also as a family member, the anxieties that we go through and the small things, even if it is complaints or even if it is small things, they give you a lot of patient listening. So that is something that we really appreciate. And from the day one till today, each member is very patient. They don't, they try to accommodate as much as possible. They ask you for feedback. Every single day they ask you for feedback, what they can do to improve. So, it's nice to actually have somebody, while you're going through your tough times and you're going through your own anxieties, there are people who actually ask you day in, day out whether you want any support, you need any support, if they can do something better. And we have a doctor here, Aftab, who keeps the entire team and the mood very lightened here in the physio room. So while initially we think it may not be a big deal, but then because we've been here for about a little more than 2.5 months, that it makes a lot of difference to the patients. because when they go down there to do that physio room and then they come back to the room, you know, their mood is kind of cheered up a little and they need that support to do their physical activities, which is very difficult because they are already in a lot of a medicated state of mind. So, and we have a physio team that is absolutely fantastic. We have Rupa, we have Ajay, we have a whole lot of people, youngsters there in the room. So, in terms of the equipments, in terms of the facilities, in terms of the care they take during the physio sessions and the kind of training, the variations they do, the kind of care, love, they pamper the patients during that 1 hour. And we have 2 hours of physio, so that makes a lot of difference. That made a lot of difference to my mother. So she needed that, she needed a lot of motivation, she needed a lot of push. So which normally that is not how she is, but then during this time she needed that. And that's what the team gave her. And that's why we have been able to she's been able to stand up and walk that bit. And we hope to take it, forward. And we have a nursing team, so they would again take care. They would check the patients during the night, middle of the night, early in the morning. It would start up with as early as 6:30 in the morning. So they would do what is needed, and everybody is really professional and very patient. Thank you to Sukino. More than thank you, I'm very grateful to Sukino. So,
though I miss my home every day, this is my second home. Because all the people are so kind, so caring. All that I am very grateful to Sukino.